Hi, I'm Dr. Weiss, and it is Wine Down Wednesday time. Cheers. I am drinking wine. This is going to surprise you. Wine from a bag tonight. It is called Medley Wines from Medley Wine Company. Comes in this cool bag. So it's not boxed wine, it's bagged wine. And it's delicious. It is Mediterranean wine. This is a blend, a red blend, that is harvested at night to preserve aromatic potential. Grapes are destemmed before cold maceration and fermentation. There's notes of currant, red fruit, and soft spices. Anyway, these are all natural Mediterranean wines, red blend. And what's nice about these bags is that they produce 85% less carbon than glass, and they keep fresh for up to 45 days. I saw an ad for it online, and they do have a white blend as well, but I thought I'd try this red one, and it's pretty good. It goes down, it's really smooth, and I'm really been enjoying it. So cheers. It's the day after Cinco de Mayo, so I thought I would drink maybe a margarita, but we didn't have any margarita mix available. So anyway, too bad. You know, I really like wine, so I'm always willing participant when it comes to drinking a glass of wine. Thought I would talk to you guys today about the importance of consultation in medical aesthetics. So, you know, I think a lot of people are online these days. They kind of have an idea. They do their own research. They come in with an idea of what they want to have done. And I think it's really important to have an open mind to come in for a consultation. So that's number one. Don't just schedule an appointment for that treatment that you're seeing online because it may not be right for you. Come in first for a consultation with either myself or Melissa or Christine, and let us evaluate your skin's condition and talk to you about what your concerns are, what your goals are. We have lots of devices in the practice. We're not a one-trick pony. And we can really design a treatment plan that is going to get you the results that you're seeking. So it's not about, oh, I saw, Kim Kardashian had microneedling with Vamp or whatever it is, and that's what I want. Well, don't want something because so-and-so had it. You want it because it's going to help you reach whatever goal that you have for your own skin. Again, when someone comes to see me, I first am going to ask, we'll review their pictures. We have the new Aura camera, which you guys have heard about previously. So we'll review your pictures together. That gives you a score. We'll go over your skin score. We will look at symmetry and all of the various factors that we can evaluate with those photos and discuss, what we're seeing there, but also discuss what it is that you were seeing before you came in that was concerning to you, or that you were hoping to, what goals you had, what you were hoping to achieve doing medical aesthetic treatments. So whether that be, hey, doc, I have a lot of brown spots on my skin that I want to improve. I have wrinkles. I have perioral aging. I want more volume in my lips. I have these nasolabial folds that I don't like, or marionette lines. I don't like my jowls or my jawline, or all of the above. And then we can consider what those treatment options are that we have to offer and discuss what downtime, like what's involved in those treatments, and really make a plan that's tailored to each individual. So it is so important, that process is so important, and determining what skincare products would pair well with that. What are you using at home now? What could you add to that to help get you to your goal faster, or help you heal faster from the treatments that we're recommending? This whole discussion needs to happen. So, I definitely recommend having a consult like that, whether that's with me or whoever medical provider that you trust who's knowledgeable about medical aesthetic treatments. Have that consultation and make a plan. You guys can then discuss financing, like what is this going to cost me? Am I going to do this over how many months? Looking at the schedule, your schedule. Do you have an event coming up? Because timing is really important when you're talking about these types of treatments. So yeah, it's not to say that you can't call an office and say, hey, I want to come in for a hydrofacial or something like that. That's fine, because a hydrofacial can never go wrong. But if you're talking about these more aggressive medical aesthetic procedures like CO2 laser, like Morpheus 8, like Cool Peel, like even neuromodulators if you've never had them, like Botox or dermal fillers, because there's considerations that you need to think about. Like Botox is going to take, neuromodulators might take 2 weeks to kick in, and if your event is next week, well, we need to talk about that and maybe choose products differently. If you're going to have the potential for bruising, maybe you don't want to have injection right before a big event because you could bruise. So anyway, there's lots of things to consider and talk about at these consultations. So I highly recommend that you have a consult like that. As a new patient, we do a consult like that with all new patients. Even if you're an existing patient, it's really important that I see you once a year, both to review your treatment plan, to review your progress, and just to review your medical history. So that's called a GFE, or good faith exam, and it's really important that we do that with you annually, and just to make sure that nothing has changed in your medical history and that we are still on the right track with your care. So we want to make sure that you've responded appropriately to the treatments that we've done thus far, and then determine, okay, what is this year going to look like for you? Are we in maintenance mode? Are we still in treatment mode, trying to reverse aging? And reviewing your home care. Home care is so important, so we're always going to review that. So making sure you're on the right, doing the right homework, right? Doing the things that you need to be doing at home to help improve the treatments that we're doing in the office, because it's not one or the other, it's all of the above. There comes my dog. Hope that is helpful for you. Going back to the good faith exam, that is something that we have to do for legal compliance in the state of Arizona. So if you are going to other practices and they aren't having a high, I forget what they call them. It has to be a doctor or a PA or someone like that reviewing your medical records annually, that is, they are out of compliance. So you have to have some means of having a GFE, someone who has a medical degree higher than an RN, reviewing the medical record for to make sure that we're keeping you safe. So that is for your safety. And then that also speaks to photos, which we've spoken about before. Like I said, we always get the photos with our new Aura camera, and that's been going really well. But some patients are reluctant to take their picture, and they have to understand that this is it's part of your medical record. We need to document what you looked like when you came to our office before we ever treated you, and we need to document what you looked like after those treatments. So that is part of legal compliance in medical aesthetic practices in the state of Arizona and in many other states. There are some states that are even stricter, that, like, you know, if you aren't a doctor, a physician assistant, even sometimes nurse practitioners are not allowed to treat independently. So there are rules in all these different states. I happen to be the co-chair of the American Medical Spa Association's Arizona chapter, so I'm very aware of these compliance regulations and changes that are happening in the industry nationwide, as well as what's happening here in Arizona. So when you're asked to fill out forms, when you're asked to get your photo taken, I know it's a pain in the butt, but don't give us a hard time, please, because I've really made my staff very, like, they have to follow those rules for me. So that's to keep you safe. That's to, protect me as a physician and our practice, so that we can continue providing the care that you want us to provide. So hopefully you'll understand that and that you appreciate the fact that we want to keep you safe. And the consultation is really part of that. Part of the reason we need to have you come in for a consultation before we do treatments is to make sure you're an appropriate candidate for those treatments. You know, we may decide that you're not a candidate based on health risk or your skin type. Maybe that's going to put you at higher risk for hypo or hyperpigmentation. You know, you have other bleeding risks or other things. So these really are medical procedures and they need to be taken seriously. So that's my thought. And I'm going to finish my glass of bagged wine and process my day that I just had, which was fantastic. I love treating patients and seeing all of your smiling faces. I have the best job ever. So anyway, thank you guys for supporting our practice and for supporting me as your provider. I love doing it, and here's to doing it for another 18 years. Okay, bye.